watching ABC.
March is Multiple Sclerosis Awareness Month. MS is a disease that affects an estimated 900,000 people in the U.S. Today, we are talking about a misdiagnosed related condition of MS called pseudobulbar affect, or PBA, which may cause sudden, frequent, uncontrollable episodes of crying or laughing in patients with MS. So joining us today is neurologist Dr. Mayor Joshua Hasbani to share insights from his own clinical experience with patients who experience PBA. Welcome to the show, doctor.
Thank you, Lisa. Thank you for having me on your show today.
Now, can you explain PBA and how it's connected to multiple sclerosis and why it's important for patients to be aware of this condition during MS Awareness Month?
So multiple sclerosis is a disease of the central nervous system that affects, as you said, nearly 1 million people in the United States. And patients with MS, the immune system cells that normally protect those individuals mistakenly attack the central nervous system. And this interferes with the transmission of nerve signals from the brain and other parts of the body. And that leads to the symptoms that patients have with MS, such as weakness or numbness. One of the other conditions that arises from this damage that's often underdiagnosed is called pseudobulbar affect, or PBA. And like you said, this is a condition in which patients have uncontrollable laughing or crying spells. They're involuntary spells, sudden, frequent, disruptive, and they can be exaggerated to how they feel, or they can be exactly opposite to how they're feeling inside. And as a result, this is very disruptive for these patients, so identifying it is critical.
Now, how does PBA differ from emotional disorders like depression?
So PBA and depression have overlapping symptoms. In both conditions, crying may occur. In depression, patients are crying because they feel sadness inside, and they usually can control the crying. And when they're crying, it's congruent with how they're actually feeling. In pseudobulbar affect, the symptoms themselves may occur exactly opposite to how they're feeling inside, or be completely exaggerated. They may be slightly sad, but the crying is extremely heavy. And as a result, it can be disruptive for patients because it can occur in social situations, it can occur at work, and this can lead to social isolation. So identifying it and treating it is important.
What challenges do patients with MS with PBA face, and how can they be addressed?
So the challenges that these patients face is that these episodes are uncontrollable and can occur in situations that are embarrassing for them. It can occur socially, it could occur at work. So addressing it and identifying it and treating it is important. There is an FDA-approved option called Nuedexta, which is a combination of dextromethorphan and quinidine sulfate, and it's been clinically proven to reduce episodes of PBA. While the most common side effects were diarrhea and dizziness, these are not all the risks from use of Nuedexta. For instance, if you're taking medications that contain quinidine, quinine, or mefloquine, or monoamine oxidase inhibitors, or if you've ever had allergic reactions to these medications, it's suggested that you do not take Nuedexta. Further, if you have a family or personal history of heart disease, myasthenia gravis, or take other medications and supplements, it's important that you speak with your doctor to determine if Nuedexta is right for you.
And where can folks go to find out more information?
For more information about PBA and Nuedexta, including the full prescribing information and important safety information, please visit treatingpba.com.
Doctor, thank you so much for your insight on this. We appreciate it.
Thank you for having me.